Good evening, everyone. Good evening, and welcome to tonight's essential discussion on the importance of dental and vision health in children. My name is Joyce Jose, and I'm a civil rights attorney along with the mental health advocate, and I will be facilitating tonight's panel. So if you are tuning in, we would love to hear where you're tuning in from. Shout out your city, rep your city, and feel free to let this be an interactive conversation and a dialogue. We will be monitoring the chat, so let us know if you have any questions for our experts. So, tonight we are privileged to have leading experts with us today who will shed light on these critical aspects of pediatric health. That's dental and vision in children. As parents, educators, caregivers, we understand that ensuring our children grow up healthy involves more than just regular medical checkups. Dental and vision health are often overlooked, but are vital to a child's overall development and well being. Tonight, we will explore why it is crucial to focus on both dental and vision health, recognize the early signs of potential issues, and learn practical steps that parents and communities can take to promote healthy habits from an early age. We'll also discuss the impact of diet, the role of screen time, and how schools and communities can contribute to better outcomes in these areas. Our goal is to leave you better informed and equipped to support the dental and vision health of the children in your care. Let's begin this important conversation by hearing from our experts about why these two areas of health are so interconnected and vital to monitor in children. So let's start. On our panel tonight, we have Dr. Samira Brown. We also have Dr. Alexis Russell. We have Dr. Ann Arthur. And last but certainly not least, we have Dr. Josephine Ibironke. Hello, doctors. Hello, experts. How are you doing?
Hey, good. Doing well.
Great. It is so good to have you here tonight. And it's so good to have this discussion. Some of y'all may have tuned in to our Seeing Eye to Eye event last night with Dr. Ibironke and Dr. Arthur, where we were talking about vision for children. So this could be a little bit of a review for you. But if you missed last night's session, one, no excuses. It's recorded. Go to blackdoctor.org's Facebook page, but you can also stay tuned in tonight because we're going to be talking about similar things that we discussed last night. So let it be either new or reinforced for you, and we'll just have the conversation flow. Again, shout out your and rep your city, and also let us know what questions you have related to pediatrics, vision, and dental. So let's get into it. Doctors, why is it important to focus on both dental and vision health in children? Is there some kind of interconnectedness, or can anyone just speak to the importance of focusing on these two areas?
Well, dental health is very important because it affects the overall development of the child. If you think about it, the mouth is the pathway to the rest of the body. So it affects the way that the child eats. It affects them socially because it affects the way they smile. It can also affect speech. So sometimes there are speech impediments with different things, in the mouth, whether it be more dental, like hard tissue, so the actual tooth, or whether it be like soft tissue, a tongue tie or a lip tie or something like that. And a lot of times that will show itself or present itself pretty early. Like if your baby can't latch, they might have a tie. So if breastfeeding shouldn't be difficult, it should be a natural thing, right? A natural attachment. So if your baby is having difficulty, all of that affects dental, and it also affects the way that the teeth erupt into the mouth. It can also affect behaviors. So if a child is having like discomfort or dental pain or something like that, it can affect their performance in school. So those are a couple of different things or reasons why, dentistry is very important, or good dental habits are very important to establish at a young age.
Dr. Russell, you mentioning babies, I think you called it being tongue-tied and having issues latching as early as the breastfeeding stage.
Mhm.
So again, when I think of dental, when folks think of dental, you think of teeth. You think of fully formed teeth, but these are newborns whose
Mhm.
mental health is affected so soon before teeth are even formed. So it's interesting that we're thinking about the palate and the mouth,
Mhm.
obviously, to part of dental health, but to the greater public. Let's just expand and broaden our concept or understanding of what dental health means. Your baby does not have to have teeth
Right.
for you to be considered and cognizant of their dental health.
Well, definitely as a pediatric dentist, we don't focus on teeth. We are basically, if you want to reterm it, we're physicians of the mouth,
Hmm.
the head and neck area. So we evaluate all of these things. We're trained in airway. So, you have to breathe, right? And be able to obtain oxygen well and sleep well in order to grow, um, you know, like you should.
Yeah.
So those things are very important. And if a baby cannot latch, that means they're not getting adequate nutrition, so all of that affects, bone development and development of the arch. The arch of the mouth is where the teeth is the house for the teeth. So if you don't have a correct positioning or correct alignment of the arches, then, or if you have like a smaller, what we call like surface area, so like a very narrow palate, then there's less space for the teeth to come in. And so that's why you'll have a lot of crowding issues, or what we call malocclusions. And so all of those things are established at a very, very young age. Pacifier habits, I mean, that narrows the arch, or it constricts the arch. So if you see children with like what we call an open bite, their teeth don't come over top of each other. Everybody naturally should have a little bit of an overbite, right? So it should look like this, not like this,
Right.
right? Or not completely closed. So that's why establishing care with the dentist very early is important. By the first birthday, it's recommended that children or infants are establishing care with the pediatric dentist by their first birthday, so that we can get ahead of these things and we can educate, the parents on what to be looking for, so that our babies don't have these issues as they grow up and develop correctly.
That is so good to know. It is never too early, from what I'm hearing. It is not too early to establish a good relationship with a pediatric dentist. So
Mhm.
don't wait until the teeth come in. By the
No,
first
don't wait
birthday,
till the teeth
let's
come in.
establish a relationship.
A
I
lot
want
of
to
people
talk.
I'm sorry. Go ahead.
No, I was just going to say that I want to talk about vision health early too, because again, I didn't start wearing glasses until elementary school, like later in elementary school, but I needed glasses a lot sooner than that. So I also want to talk to the panel about establishing a good relationship with a pediatric optometrist, ophthalmologist, pediatrician, period. Can we talk about the importance of vision health at an early age?
Sure. So I'll go on that one. So it's very important to focus on vision health, and the reason for that is if we don't, we may miss some things that could affect how a child is developing and how a child is learning. So some concerns will be if they can't see well to start learning their colors, their alphabets, their shapes. When they get a little older, comprehension is going to be affected because now they're reading to learn, and they haven't established that they needed glasses. Maybe they have farsightedness, nearsightedness, astigmatism. And as we were discussing yesterday, there are other things but beyond that. Things, genetic disorders that may have some visual sequelae. We need to be able to identify those early. So that's why it's important to also focus on eye health.
Right. Anything to add to that, Dr. Arthur?
Well, I think with some of the, in terms of dental as well as vision health, one of the things that we want children in our community to understand is that they can start these lifelong relationships very early. And it's just part of a pattern of I go for my well check with my pediatrician, I get my oral health evaluated, I get my eyes checked, and it becomes just sort of standard. When I first started practicing 20 years ago, over 20 years ago, I was in Brooklyn and people were like, what? A dilated exam? What's that? Why would I be doing that? Why would I be seeing a pediatric subspecialist? Whereas I think now people understand that this is just part of, I like to tell patients, there's nothing here that I'm doing that's extraordinary. This is just a routine examination that you just have to understand that this is routine and comprehensive. So.
And that's comforting as what I'm going to call a civilian or someone who's obviously not in the medical field, because Joan Brown, thank you so much for joining us. They commented a lot to process, and it is a lot to process, and it's so easy in the age of information to just be overwhelmed. Like, okay, when do I do this? What does this mean? The great thing about working with doctors, the great thing about working with experts is that when you go in to see them, they process with you. You're not just given this information and just left to your own devices. These people are trained. They've had years of training, fellowships, specialty training, and experience so that you can get this information processed alongside with you, explained with you. And this is a relationship. This is a partnership, and a lifelong one it could be. So don't feel like you're doing this by yourself. This is why we're having these conversations, to kind of enlighten people and to make you feel empowered and encouraged. But you don't have to understand everything that we're saying. There is going to be a doctor in the room to help process this information for you and explain why it's important. So share this conversation, because it really can change our communities and change the outcomes for our children, which is what's most important. We kind of talked about this. Oh yeah, sure.
I was going to say, Joyce, you really hit a really main, point that I think we really cannot stress enough. You really want to make sure that you're comfortable with your providers, that you don't stop at the first doctor if they're not listening to what you're saying, or you think that there's something wrong with your child. We know that parents know their children the best. And so you want to make sure that you're really comfortable with your provider, and don't be shy about asking for a second, third, fourth opinion until you really are comfortable. And make sure too that I feel like a lot of times we may send someone out or tell them that, they need to establish care with an ophthalmologist or with a optometrist, even dentist, right? And then they come back to us and say, they say I don't need to be seen until 3 or 4, right? So really not, making sure that we're engaging and making sure that who you're seeing is actually up to date on the recommendations for children, because that I feel like we find very commonly, unfortunately, and especially in our community, that our patients are not being seen in the same way and to the same level of quality care that they should be receiving.
Dr. Brown, I really appreciate what you said in its entirety, and especially what you said about you know your children best, you know your child best. You are your child's best advocate, and this kind of segues into my next question, and that is early signs that parents should be looking out for regarding their child's dental and vision health. As a pediatrician, are there early signs that you have noticed in children that would make you want to have them see a specialist like an ophthalmologist? And what could parents be looking out for in both vision and dental? Either or, I'd love to hear your perspective as a pediatrician.
Yeah, that's a great question. And some of it's already been mentioned. As pediatricians, we're constantly doing exams and examining growth and milestones and those kinds of things. And just like Dr. Russell talked about, in the very beginning, sometimes babies aren't gaining weight. Moms are talking about this very painful latch, right? And even though they're able to get the baby on, baby's eating, this baby just is not gaining weight, right? And that latch typically is staying very painful. So especially when we talk about tongue ties, that definitely is one of the things that even when it looks like the tongue has good movement, sometimes they really do need to see a specialist to see if there is really enough for the baby to get the tongue all the way under the breast, right, to be able to make that milk come down, right? Because if that's not effective, then they can be on all day, but they're really not getting the milk that they need. And then that ultimately affects mom's milk supply. So those are some of the things that we see in the beginning, as well as Dr. Russell talked about, just a general exam, like what does the palate look like? How are they swallowing? How are they breathing? Are you hearing noise all the time when your baby is breathing, right? All of these things, right, that you want to make sure that you're pointing out to your pediatrician if you seem like something is not quite right. And absolutely, anytime we see that that growth chart is going awry, that really is, in a sense, a vital sign. It's just like a heart rate or a blood pressure. That's something, really needs to be looked into. And then in terms of developmental milestones, one of the things that we find, right, is that especially kids who cannot see well, is that their fine motor is delayed. So that is definitely one of the first signs that we'll start to see, just like with speech. If kids are not starting to have those developmental milestones of cooing and babbling, one of the first things we think about is their hearing, right? So these are the kinds of things that, even though there are certain things we can do as pediatricians in the office, usually they really need a more thorough exam with an expert. So that's why we really want to make sure that you're seeing a pediatric optometrist, a pediatric ophthalmologist, a pediatric dentist, because there's a significant difference in the amount of training that pediatric specialists get.
That's really clarifying. Dr. Ibironke, any other early signs that parents should be looking out for in terms of vision specifically?
Sure. The pupil, so when you're taking a picture and like a selfie or a picture, and you see instead of a dark pupil, you're looking at like a red or a white pupil. It's not supposed to be that way. Or if you're looking at a child and it looks like the eyes are turned on the child, one eye or both look as if they're turning into the nose or out or up. Or things like behaviors, holding their head a certain way, tilting their head a certain way, or even things like rubbing their eyes. So they're just showing just behaviors of almost distress. You need to be able to come to us. Hey, let's get the eyes examined. Allergies, just rubbing the eyes all the time. It could be any of those things. So those are some of the warning things you need to look out for.
Interesting. I know before I had glasses as a kid, I used to hold one eye instead of squinting. I would hold this eye because it was like my better eye and pull it back because it made my vision clearer. And my parents just thought I was doing something silly, but I was just trying to see. So anything that you may think, oh, that's just a quirky thing that my kid does, you're never over exaggerating. It's easier for a doctor to be like, oh no, it's fine, than for you to kind of gaslight or second guess yourself as a caregiver, as a parent. Let the doctor tell you it's fine before you brush it off. Because again, these are such foundational kind of building block times, and we do not want to jeopardize our child's ability to learn, to grow, and to develop. Dr. Russell, I'm going to come to you as the dentist on our panel. At what age should a child first visit the dentist? Now that we know that it's not just about teeth, and how often should they go for checkups?
Care should be established, or a dental home should be established between the eruption of the first tooth, which is typically around 6 months, and latest by their first birthday. So every child should have a dental home by the first birthday at the very least. A lot of things are changing within that amount of time. And we know things change very quickly with infants and babies, and then they turn to toddlers. And the time just passes by very, very quickly. And getting all of the necessary information, or what we call anticipatory guidance, early gives the parent a perspective on what to look for, like signs and things to look for abnormalities in different things, and as the child grows up. And I do recommend, so it's different for everybody, but I do recommend that a child be seen every 6 months. There are situations where, children should be seen more frequently, like maybe like a 3-month basis, or, quarterly. And that's going to be based upon what us as the pediatric dentist see on that initial visit, or maybe a child with medical complexities, or things like that, or a child who builds up plaque or calculus a lot easier, or even a child who has dental anxieties or dental fears. Bringing them into a place or bringing them into the office more often helps to familiarize them with the setting and with the doctor and with the staff, so that they're more comfortable, coming to the dentist.
That's so important because there's still, I mean, I hate to tell you, but you probably know, a stigma about going
Yes.
to the dentist's office.
That's why you got to bring them in early. Establish early.
And that makes so much sense because guess what? I am way more nervous about going to a dentist than I am an eye doctor, because I've seen eye doctors for so much of my life, but not as regularly dentists, I hate to admit. But guess what? If you make it your child's norm to see a dentist twice a year at minimum, by the time that they get older and become full-fledged adults, there won't be a stigma, there won't be a fear, because it's part of their routine. So what a beautiful habit to cultivate. And you know what? I am an expectant mother. I want this to be a part of my child's routine as well. So it's so good to know this. And I want him to be like, oh yeah, I've been going to the dentist since I was 6 months old. So fantastic. Establish care at the very latest by 1 year old, but 6 months is the best of the eruption of the first tooth. And then thereafter, at least twice a year, and your dentist will tell you if you need to come more frequently. I want to move to when we should be establishing care for a child's first eye exam and how frequently those exams should occur. Dr. Arthur, I haven't heard from you in a while. I said I wouldn't call on people. Totally.
Well, for one of the things that I try to explain to patients is that we depend on people like pediatricians, like Dr. Brown, as well as school nurses and other caregivers to really do that initial screening for us. As a pediatric ophthalmologist, we're seeing more medical surgical diseases of the eye. So what I tell parents is that after 3 months of age, you really should expect 3 or 4 months of age that the eye should be properly aligned. So if you think the eyes are crossing after 12 or 14 weeks of age, then you really want to present to us and have us look at that and evaluate that. Very early on, the first few weeks of life, the eyes can do all sorts of weird little movements that people shouldn't be too stressed about. But once again, if you're 4 or 5 months old, you really should have eyes that are working together and properly aligned. We like to see children for a routine exam around age 3 or 4, preschool age, because they are usually verbal. They're able to read the eye chart, even if it's pictures. You're able to kind of explain to them what you're doing, and some of the fear is out of the way. That being said, we examine kids who are newborns, who are infants. If there's a problem, we want to see that kid. So anything that a parent in particular feels is problematic can present to a pediatric subspecialist. The optometric community may have some different standards that they use because they might be looking at more refractive errors and picking those up earlier, whereas I'm looking for more medical or surgical diseases. And so Dr. Ibianca may have some pointers on when they want to see kids. But we usually say the first exam, we want to see them at 3 or 4, but we'll see you at any point if you have a problem. And definitely kids who have other systemic issues like sickle cell disease or type 1 diabetes or inflammatory immune diseases. We're seeing those kids fairly frequently, sometimes every 6 to 12 months, depending on what the condition is. So if you have a kid who has another systemic illness, you want to get some guidance from your pediatrician about them getting proper eye care.
I kind of want to stay on that because we know that sickle cell predominantly, at least in the West and certainly in countries in Africa, affect Black people. And so does diabetes. Can you explain why sickle cell and diabetes especially have an interconnectedness with your eye health, and it changes the frequency that you'll be seeing an ophthalmologist or an optometrist? And if it's too complex to explain,
No, it's not. It's not too complex. Sickle cell. There's different forms of sickle cell, so I won't go into all of that. But let's just say sickle cell puts you at an increased risk to develop what's called sickle cell retinopathy, which is a disease at the back of the eye where you can have abnormal blood vessels that can grow. And these abnormal blood vessels are weaker than your normal blood vessels, so they can kind of break or bleed and cause hemorrhages inside the eye, or they can grow aberrantly and pull on the retina and cause retinal detachments. So the worst case scenario, you can actually become blind because of poorly controlled sickle cell disease. That is possible. This doesn't happen to me too often, but I've actually diagnosed people with sickle cell disease based on an eye exam, or people who didn't know they had sickle cell disease until they had an eye problem. So usually if they have sickle cell, once again, I probably see these kids a little bit earlier. I think most of the literature will say from age 10, they should be seeing once a year. I'm probably seeing them much younger than that in my community, which I have no problem with because I feel like these are kids who have not really been getting a lot of attention from the medical community. But most of my sicklers, I'm seeing them once they hit school. So if they're 5 or 6 years old, they're coming in annually.
Thank you for that. Dr. Ibironke, anything to add about when you would like to, as an optometrist, when you would like to see children?
Yeah, sure. So the American Optometric Association does specify that by about 6 months that they already have the first eye exam. 3 years, 5 years, and then when they start school. And the reason for that is just to make sure that we catch anything and detect it early. However, that being said, and Dr. Arthur already said this, and I'm going to echo what she said. If you notice your child has one of those behavioral problems or something behavior that you're noticing or the appearance of their eyes or they're complaining about something, don't wait until those specified times. I think today in clinic, I saw a kid that was 4 months old. So they didn't wait till that 6 month to say, oh, I'm going to wait till 6 months. Don't wait. If you notice something, you see something, you bring it in right away, make that appointment, go in to see your eye care professional. Don't wait at all because the earlier we catch these things and take care of them, the better.
That's great to know. So by 6 months, your child should have already had his or her first eye exam. And again, knowledge is power. Do not wait. You don't want to have your child behind developmentally by not going in. And I remember Dr. Arthur saying by 3 to 4 months, your child's eyes should be more or less aligned. So if you're seeing something, go in sooner than the 6 months. Do not wait. I do want to go back to oral hygiene in children because, again, we are going to break the stigma and break the scaries that we get when associated with dentists. And I want to hear from Dr. Ron and Dr. Russell. Oral hygiene. I didn't grow up really liking flossing. I could brush my teeth. I thought like mouthwash was a lot of fun to use. But how do we encourage oral hygiene for children who are antsy and jumpy and don't want to go through the whole routine of it? How do you make it engaging, fun, and consistent?
Yeah, I mean, kids love to play, right? So a lot of times we're going to engage it like that. They also love to do what you are doing, right? So a lot of times it's like, I get a turn, you get a turn, you're using songs, you're dancing around, right? And again, just like you talked about, you start very, very early, right? So they're all ready, right? They can grab something, certainly at 6 months, they can put that toothbrush in their mouth, right? And you want to make sure that you're starting that process really early and letting them hold on to it, right? So the last thing that you want to do is like strap them down and it's 2 people and then you're getting in there, right? And it's like more of a tackle, right? You really want to have fun with it, be gentle, and understand that it takes kids time to warm up, but they love to imitate their siblings. They love to eat and drink what their parents are doing. And I'm sure we're going to talk about that too. So those are the kinds of things that you can do to warm kids up. They have great books, right? So that's a great way for children at that developmental level to really understand and give them context about something that you want them to do, whether it's brushing their teeth or going to the bathroom, all those kinds of things. Books are a great way to engage kids, and you really just want to stay relaxed, have fun, and remember they're going to feed off your energy, right? So if you too have those dental scaries, then we encourage you too to come in and really start to get over that, because your kids are going to feed off your energy.
I echo everything that Dr. Brown is saying. Modeling behavior is very important. What the kids see or what they're going to pick up, so behaviors, habits, and things like that. So doing or brushing with your kids is going to be important, especially at an early age. So they see you doing it, they're going to want to do it as well. Also, Doc McStuffins and Gracie's Corner, they have a great dental episodes. So playing those episodes for them where, there's lots of music, it's fun, it's animated, things like that help as well. And as the child gets a little bit older and they're able to understand rewards or offering rewards and encouraging positive behaviors and reinforcing positive behaviors is going to be very important, because then they'll associate brushing with something that's good, right? And I get something every time I do something well, or I'm go brush my teeth. So that's important as well, and it works really well as well.
I love that positive reinforcement. I play that trick with myself. Like if I go to the gym, I get a treat. So of course it's going to work on children, but I especially love this idea of turning it into play, turning routine and important oral hygiene activities into play. I have pictures of me and my dad sitting on the counter and I'm brushing my teeth and he's brushing his teeth. So that kind of unlocked a core memory, Dr. Brown, when you're saying that kids like to mirror what their parents are doing and they want to be grown up and they want to, try new things. So it's nice that you can do this activity with your children and they can see you doing it. Shakisha Brown or Barron, thank you so much for joining. She's agreeing with us, so we must be onto something, right? They do. My kiddos loved it, and they loved it also when you help them. That's really, really beautiful. So yes, making sure that they're holding the brushes and the tools correctly. What came to mind as we were speaking, though, are chemicals. What kinds of chemicals should we be avoiding? Should we be nervous about certain things? Is it fine just to go with whatever is labeled as like toothpaste for kids? Can they use toothpaste for adults? What should parents be looking out for in terms of oral hygiene and chemicals?
Well, when we're talking about dental stigmas, fluoride, there's a definite dental stigma when it comes to fluoride. But it's very efficacious, and you can use it as, at a very early age once you start brushing. It's just the amount of fluoride that we're using, or fluoridated toothpaste that we're using. Those training toothpastes, they're there just for show, basically. It is, we're going to put something on this toothbrush and we're going to put something in our child's mouth that tastes good. That's all it's good for. So you definitely,
so it will not get your kids' mouths clean.
No, that's definitely not what it's for. It's there to help establish that habit, that good habit, but it's not. There's no preventative effects in it, right? Like there is with a fluoridated toothpaste. So you can start with a kid's fluoridated toothpaste like Crest or Colgate. Those are the largely known brands. And for a child that is 0 to 3 years of age, you use a smear amount of toothpaste on the toothbrush. And that's because we know they're not able to spit yet, and we don't want them to ingest a large amount of the toothpaste, right? So, but using that small amount, you're still getting the preventative effect from the fluoride. And then you don't have to rinse their mouth out. You can just take like a wet washcloth and just kind of wipe it. And then from 3 to 6 years of age, or 3 to 6 years of age, you can increase it to a pea size amount of toothpaste. And then from 6 and up, because they understand the routine, they understand the habit, they know how to spit, they know how to rinse. You can increase it just a little bit more. But fluoride is good. Fluoride is good for you. It's just, everything in moderation, right? You don't want the child to ingest a large amount of fluoride.
So good to know, because there's so much out there. I don't know if you've heard of like the crunchy mom movement, where everything is natural and they're making their own stuff, but you want what you're using to be effective. You don't want your kids mixing things that just aren't actually cleaning their teeth. So you heard it here. We are breaking the stigmas. Fluoride is okay, just in moderation. Start with a smear, work yourself up to a pea size at ages 3 to 6, and thereafter you can ask your pediatric dentist about the recommended amounts. But fluoride is perfectly fine. Okay, so we've talked more about the teeth, we've talked more about oral hygiene. Let's bounce back to vision. We talked a little bit about some things to look out for, but I want to get into the nitty gritty and get a little deeper. What are some warning signs, just practical warning signs, that a child might be experiencing vision problems? So we talked maybe about how they move their head. I shared my anecdotal story about pulling my eye back, but warning signs for newborns, warning signs for toddlers, what should parents be looking out for?
So I can take that as well. So we do the ABCs. So the appearance, behavior, and complaints. So appearance, we talked a little bit about the appearance. You said how you were pulling your eyelids kind of away from your eyes. You were basically squinting for yourself. So if you see the kids squinting, head turns, eye turns, the appearance, you looking at them. I know yesterday when we were talking, Dr. Arthur had said something about tearing a lot. Kids that have glaucoma. I know that's rare, but then it does occur where you have this tearing, you have the eye it looks like it's actually kind of bulging out a little bit. So if you see something that just looks abnormal to you with the eyes, another thing that we do is we compare children, like, oh, do you have another sibling? How does that sibling compare to this one? Did you see the eyes crossing on big brother or big sister? And then complaints. So, hey, I can't see, or it's blur, or I see two of things. Those are those complaints that we're talking about. Even complaints from the teacher may be something that you want to bring to the attention of the eye doctor. And then behaviors, that's that squinting, that's that rubbing, moving so close to the TV. Sometimes that could be habit, but sometimes that's actually a cry for help. So those type of things is what you want to look, just the ABCs, the appearance, behavior, and complaints.
Awesome. I love it when there's something snappy that you can take away and it's practical. ABC, appearance, behavior, and complaints. Again, like Dr. Brown said, and we all agree, you are your child's largest advocate and you know your child the best. So watch closely, listen closely, and take it seriously until you're told by an expert otherwise. Dr. Arthur, any other warning signs?
I think Dr. Abernathy covered it pretty much. I would say also to trust your gut. Some of the things that we see with eye health are intermittent. So they're not constant. They may be more common at the end of the day, or if a child is fatigued. You may notice things in bright light more so than in darker light. So I think you have to kind of trust your gut. I mean, even when I see patients, sometimes I say, I don't see any eye crossing or turn, but I was with your kid for 20 minutes. Maybe we should take another look in 3 to 6 months. Or if you feel like there is something happening that I miss, come back, right? So I think we have to emphasize that some of these things are just not constant. Sometimes they're intermittent or maybe seem fleeting to a certain extent. And so I will say one of the very rare case of retinoblastoma I picked up, which is an intraocular tumor in a child. And the parents said, every once in a while I see this white thing go by. And basically they were seeing a tumor, but the way it was situated, it wasn't always in the center of the visual axis. So they were seeing this tumor, but it wasn't constantly there. And so you really have to sort of respect your own intuition, I think, as a parent, and trust your gut if you think something's going on.
I want to talk now about everyone's favorite topic in the modern age, and that is screen time. Dun, dun, dun. There's been an uptick in screen time. I'm personally not against a little bit of screen time because whatever helps keep your child occupied so you can maintain some semblance of sanity. But I am a real advocate of moderation. But there are still some legitimate concerns that I think we need to discuss. So I'd like to hear about how screen time can impact a child's vision and what parents can do to mitigate any negative effects. Dr. Brown, first, do you see the difference between children with excessive screen time and minimal screen time? And do you have any thoughts or ideas about this?
I mean, so many thoughts.
You're in a safe space. So.
Yeah, one of the things, I mean, and we like to meet families where they are, right? And in the beginning, if you haven't started it, right, we really want to talk about what the recommendations are. Really, under 2, we don't recommend any screen time. And really, if you're going to do a little bit before then, we really want it to be conversational, right? So you could do like a FaceTime call or something like that, where they're actually engaging with someone and getting exposure to different language and social cues and those kinds of things, because their brain is constantly growing and developing, right? And you don't want those messages coming from somewhere else. You want them to really come from your environment, right? So we really want to try to put those things down and really promote, right, their attention span. They get better sleep, right? We know that their vision, can definitely be impacted for, those 3 main reasons. In addition to their development, we really try to turn screens off. And then if you are going to do it, just like you were talking about, very, small amounts and educational, right? So making sure that it's commercial free, because there are, millions and millions of dollars that are poured into media to message to your children to change what kinds of things that they want, right? So they get a lot of that messaging, different morals maybe than your family believes in, right? So you really want to think about what kind of messages your kids are getting. And also the pace of it, right? So a lot of times programs are super fast paced, right? And they're made that way to keep them on it, right? But really, in order for kids, especially very young toddlers, preschool, kindergarten age, they really need things presented in a slow fashion. Just like if you ask a kid a question at 3, it's going to take them a beat, right? They have to think about it, and then they're going to respond back to you, right? It's not that rapid pace, right? So everything has to be slowed down so that they can learn about things in the appropriate way. So if you're trying to use screen time to teach a concept, they also need to be sitting with you or someone who can put it in context with them. So screen time should also be done with someone with them. And that gets into a whole host of other things as they're getting older, and YouTube and those kinds of things that put them down this path of getting them more interested and more hooked and those kinds of things. So you just want to be really careful about what you're allowing your kids to get exposed to. And remember, you really want to control that message, and also who's, engaging with your kids, especially when they get older, as we know that comes with a whole nother host of dangers for kids who are putting their information, on the internet.
And this is a part of the Healthy Kids Summit. And I would love to do a whole separate panel on screen time.
Yeah, I was like, we could talk.
Mental health. Again, this is such a critical time because your brain is being developed. Your brain is being developed, and brain develops so rapidly. It's why they can absorb multiple language and different information acquisition. It's why things happen so quickly, because their brain is changing all the time. And I understand that there is an interconnectedness between the brain development that Dr. Brown is talking about, and of course your eye development, because they all work in tandem. So can we talk about some adverse effects or some things to consider when talking about screen time, exposure, and access by kids and their visual development? Are there negative effects? What are they? And how can we as parents be diligent and to mitigate some of those effects? If, let's say, they're past the age of 2, Dr. Brown, do you want to try? Like, what should we do?
There are studies out there that show that actually being on the screen time too much, that means you're focused really up close a whole lot. So that when you look out to look away, you've now developed nearsightedness. So it can increase nearsightedness at a quicker rate too. So as kids get into their teen years, we expect them to have nearsightedness or develop into that. But if they're on their social media or their phone or their iPad screen time, a lot of it, they're going to get into that quicker. And not only that, so let's say a kid doesn't get into nearsightedness, there's also ocular discomfort, because what are they doing? They're looking at what they're looking at and they're not blinking. So their eyes get redder, their eyes get irritated because they're supposed to be blinking and they're not doing that. So they have that discomfort, the redness that may occur, in addition to maybe even their nearsightedness just increasing. I know something that's prescribed is the 20-20-22, where after about 20 minutes, look away 20 feet for about 20 seconds and blink 20 times. So again, after about 20 minutes, look away 20 feet for about 20 seconds and blink 20 times. And the 2 that's at the end is also go outside and play for 2 hours, because that'll minimize how much time they're on the screen. So those are some things that parents should think about.
And I just want to say that parents, think about it for yourself as well. Going through law school, almost everyone came out with the prescription. And it didn't matter if you wore glasses going in or you didn't. Everyone came out of law school with a prescription because we were so close looking at our screens and not taking that break. So maybe as adults, we can't afford 2 hours of play. Unfortunately, what kind of world do we live in? But 100%, we should also be thinking of that 20-20-20 rule. I love that. I love the ABCs. I love your 20-20-20 rules. I think it's really important for our eye care as adults, but especially for our babies, especially for our children whose vision is still so fundamental and still forming and still precious. So I appreciate those considerations. I do want to go to one of my favorite things to talk about, and that is food. So, before I do that, Lisa, I want to mention this for the panelists, but she's saying great topic, and she shared it with her younger family, and it's so encouraging to hear. I also think it's a great topic. I'm taking notes for myself and for my future baby. So again, share this. Knowledge is power, and our community deserves to be informed and empowered. So, food. How does diet affect, love it. How does diet affect both dental and vision health in our children? Sugar,
This is an interesting question, because I know some of us are not as highly resourced in terms of food, but in general, in our country, our issue is not one of, food deficiency, right? We're really probably weighing in more on probably eating a little bit too much or high caloric or starches or carbohydrates. So one of the things that I'm seeing in my practice is, a big increase in children with type 2 diabetes, which has a major effect on ocular health and can be vision threatening in terms of developing retinal disease. And this is something that I wasn't seeing, 20 years ago when I was starting in practice, where I'm seeing kids who are coming in with type 2 diabetes and now have to be really monitored very, very closely for, adverse effects to their vision. And that is, unlike type 1, where, you have a more immune response that's affecting the pancreas, type 2 is something that we have some control over in terms of what we're eating and in terms of exercise and diet and things like that. So I think that's one of the things I would keep in mind.
A lot of time. Oh, go ahead. I'm sorry.
No, I was calling on you, so.
Okay. Well, kids these days have a very high carb diet. There's a lot of intake of sugar, which too affects, the type 2 diabetes, or the onset of the type 2 diabetes. I mean, I hear it every day, uh, that my child eats too much candy. And I'm like, well, who's who's providing the candy, or how's the child getting to the candy? Are we bringing it in the house? So it's a conversation with the parents as well, and what they're allowing their kids to consume. But we know a high sugar environment, a high sugar diet increases the likelihood of cavities, right? Mm-hmm. So it creates that environment, or what we call like a sugar bug environment, because it decreases the pH in the mouth, right? So when you have a lower pH, it's a high acidic content, right? And so what does acid do? Acid eats through things. So naturally, the acid is going to eat through the enamel, or the layers of the teeth. And so that's how a cavity starts. It's allowing that environment, or creating that environment. And in addition to that, children aren't drinking enough water. They're drinking sugar sweetened beverages. So that increases, the amount of sugar in the mouth, but it also increases xerostomia, or what we call like a dry mouth. So having a dry mouth with lots of sugar that has a high acidic content is just disastrous for the mouth. And so that's what we're coming across, or we're seeing a lot. And that's how this cavity process is starting. And children's taste buds are really developing, at a high rate within their first year of life. So if you're introducing sugar at that early age, which has no nutritional value, then their taste buds are going to be acclimated to sugar. So they're always going to want that, or basically almost like fiend for that sugar, and they're not going to be satiated unless they have that. So refraining from giving children juices at a young age, and giving them candy at a young age, especially within their first year of life, would be my recommendation. They don't need it. So
I just wanted to say, I love the fact that you brought up the juices. I had a pediatric dentist who would say to me, "That's just liquid candy."
That's all it is. No nutritional value at all.
Yeah.
And it's not a necessity. And some parents feel like they need to give it to them. And I try to educate them and let them know that this is what happens, when we start these habits early. In addition to that, and like I said earlier, like everything is okay in moderation. So if you want to give your child a high carb snack, maybe once a day, but then couple that with a glass of water, or a cup of water, then that's better than giving them a sugar sweetened beverage and a high carb snack, such as chips, cookies, crackers. Our kids love Cheez-Its, Goldfish, all of that, and it's very sticky. It sticks onto the teeth. So it's just creating that environment. So, give them that one little snack, and give them that water to wash it away. And then, that'll help. That'll help keep the cavity bugs at bay.
Yeah, and normalize it. Normalize it by eating what your kids are eating. Normalize it by introducing whole foods to your children's diet. So eat the same as a family. And guess what? If they don't see it at home, they're not going to have access to it. There are things I did not see in my home, so we didn't eat it.
Right.
We got popped at parties, and that was it. So I'm curious, though, about resources, because a lot of people aren't feeding their kids junk and things because they want to. They really don't understand or know better. Or a lot of people aren't going to an optometrist because they really do not know better. So, Dr. Brown, in your setting as a pediatrician, what are resources available to parents for more information and support on dental and vision health? What kind of information do you give them?
That's a great question, because I think one thing for parents to understand is that, listen, you are not alone out there. You can talk to us. There's a great website by the American Academy of Pediatrics that's designed specifically for parents and caretakers of children called healthychildren.org. And that has, great resources really on all health topics, in terms of a child. And also too, I think we talked about before about marketing, right? It's hard to tell what is healthy because of marketing rules, right? So when you look at a box of something, oftentimes they're telling you how much fiber is in there or that it's low fat. And of course, when they take the fat out, they put the sugar in so that it still tastes good, right? So the FDA has now put on every single nutrition label added sugar. So under the carb section in the nutrition label, you will see a line that says added sugar. And some of the things that we are eating or drinking, you would be surprised how much is in there. And the other thing that you want to look at is serving size, right? And that's going to be the serving size typically for an adult, right? So you really want to look at that. Certainly for all kids, we really don't recommend, this is again, that 2 years of age, no added sugar under 2, right? It's so inflammatory to the body, and it could potentially be tied to other chronic illnesses that they could develop later, like diabetes, like cancers, heart disease, those kinds of things. So you really want to think about natural sugars, right? The fruits, veggies, those kinds of things. Whole grains are more what we call complex carbs instead of a simple sugar. So brown rice instead of white rice, right? Or whole grain bread instead of white bread. And so a lot of times in our community, even if we have access to food, it's not high quality food, right? So you really want to think about the quality of what your kids are eating, and those habits they start very early, like Dr. Russell was talking about. There is even research on what we do when we're pregnant and how that may influence the taste buds of our children, right? So I think there's more to come, on these topics, but right from the beginning, right, they need breast milk or formula, and then they need water, right? We really don't recommend juice, especially under the age of 1. And then even at 1, we recommend no more than half a cup or 4 ounces in a day max, right? And that's of 100% juice. And that still, again, just like Dr. Russell said, is not something that they actually need in their diet at all. But we just want to make sure if you are giving it, that you know what the limit would be. So it's much better to eat an orange than drink juice. And juices can also come with things like arsenic or lead and other different exposures. So the more natural you can be with the kids, the better. And just as you also pointed to, Joyce, oftentimes there may be somebody else at home, or the pop is for, grandpa, right? But who else is going to get the pop? And I think also too, we really have to be, supportive of our children who at those young ages, if they open the fridge or if they open that cabinet and there's a choice between chips and a carrot, if there's choice between water and a Coke, what are they going to choose, right? So instead of the child getting in trouble for eating the soda or drinking the soda that's not for them, it really is better if it's not there, because it's not healthy for us either. So even at 6, we would say no more than 1 cup of juice, of 100% juice per day for anyone 6 and older. So that includes us. And added sugar beverages, we would say no more than 1 cup in a week.
Wow.
In a week. So if you think about like sugar in your coffee or sugar in really anything, sweet tea, lemonade, fruit punch, so we really just got to get back to water. We've got to get back to water.
And that goes back to the beginning of our conversation about modeling behavior. We're modeling behavior in our oral care by showing how fun that could be. We're modeling behavior in our diet by providing them only whole foods that are available. We don't have to demonize food, but we can uplift other foods while pushing others to the background or relegating them to the store. They don't have to be in your house for you to enjoy it. What a fruitful, emphasis on fruit, conversation. I personally have gained so much from your expertise. from your brilliance and your graciousness. I am so proud of the work that each of you do. And again, remember the ABCs that Dr. Ibaronke talked about. Can you talk about it again? Appearance, behavior, and complaints. Listen to your children. Dr. Brown talked about you being your child's best advocate. Dr. Arthur talked about intervention early. It is never too early to get that relationship going. And Dr. Russell taught us that dentists aren't scary. Start that relationship early, before the age of 1. Model, mirror, and share with our communities. Thank you, women, so much for your work and for your service. And thank you all in the audience for listening. Continue to share and stick around for more information. Have a great evening wherever you are.